Welcome to Motors in Medicine. On today's episode, I'm going to be discussing disc herniations. So I'm going to start by defining what a disc herniation is, what causes them, and then how we treat them. Now, disc herniations are a pretty common condition, and they can occur in a number of different instances and a number of different age groups. So I'm just going to start by describing what a disc herniation is. And to do that, I actually have a model here that I'm going to use to kind of illustrate to you guys what exactly it is that we're talking about. So if we're talking, this is a model of the vertebral bodies with discs in your spine, okay? This is the posterior segment of what your spinal column looks like. So you have your transverse processes here and your spinous processes here. You have your facet joints here, and then here are your vertebral bodies, and then this is, of course, the disc matter. So that's basically just a model of what your vertebrae and discs look like in any portion of your body. Now, this happens to be a model of the lumbar spine. But essentially, we're going to define a disc herniation. Now, these discs in your spinal column are a special type of cartilage called hyaline cartilage. Its main purpose is to provide cushioning so that you can have flexibility in your spine and you can actually carry loads in your spine. Now, a herniation is when the load in the spine outweighs the carrying capabilities of the disc itself. That's one possibility. Number two, a herniation can also occur from traumatic force, where you get a sudden compressive force coming one direction or another, or backwards. And these compression forces are what are more typically seen in accidents, trauma, car accidents, high velocity accidents, or accidents that involve really bad falls, things like that. So those traumas where you force the vertebral body one over another and the disc in the middle gets compressed, then the disc itself can rupture. And when it ruptures, that's basically a herniation. And I'm going to illustrate that here in a minute, what exactly it looks like. But in essence, the discs themselves generally are fairly robust structures and can withstand quite a bit of force. It actually takes a fair amount of force to rupture a disc. Now, there are caveats to that. The first is being your overall health, your diet, your age, risk factors. If you have other comorbidities like diabetes, there are several different conditions that can increase the propensity for developing disc herniations. Of course, if you have, say, employment where it requires you to do a lot of heavy lifting and you're not using proper technique or form, then of course this type of injury can occur. So essentially, when we're talking disc herniations, I'm going to give you guys kind of like a side view here. Now, again, remember, this is the spinal cord, and this here, I'll point to it, this here is a nerve root coming off the spinal cord. This, of course, again, like I said earlier, is a disc. So I'm going to bring a zoom in and just kind of show you what it looks like when you have a herniation. So this particular model allows you to squeeze, and then you can kind of see this big bubble forming here. That's a herniated disc, okay? With enough force and trauma to the discs themselves, whether it be from a car accident, lifting something extremely too heavy, poor form, any other type of high velocity trauma to the back, and you can create this trauma to the disc itself. So the compression forces outweigh the integrity of the disc body itself, and you end up with a herniation. Now, depending on the size of the herniation and how much it entraps the nerve or causes impingement of this nerve root is going to determine how your symptoms are manifested. So you can have anything from mild, just if it's a small bulge that isn't quite touching the nerve, like in that case there. So I'll try to illustrate it so you can see it a little bit better. There's a mild bulge there, but it's not quite touching the nerve. Or you can have a big herniation where it's actually crushing the nerve there, right? So symptoms are dependent and commensurate with the size of the herniation and the entrapment of the nerve root that it's compressing upon. And those symptoms can vary from very mild pain to significant pain and dysfunction. And by dysfunction, when you're compressing nerve roots, everything distal to that nerve root. So downstream, down the leg, for example. If this was the lowest portion of your spine and this was the sciatic nerve, everybody's familiar with sciatica. And that's just that really bad pain that goes all the way down your leg and can terminate either in your big toe or your little toe, things like that. And if it's a significant herniation, it can actually cause dysfunction to where you can have weakness in the leg, you can have numbness and tingling, you can have inability to bear weight because the muscles just aren't firing very well downstream. So there's a lot of different things that can happen from that type of herniation. So when it comes to herniations, I'm going to talk a little bit more about the causes. Now, essentially, I've mentioned a few already, but in essence, most of the time, it's going to be some sort of high velocity trauma that can cause these herniations to occur. Like what you see with a very high velocity car accident, not even necessarily high velocity, but just a lot of high force within that car accident. When you're in a vehicle and it's simply just a matter of physics, you have a large vehicle that you happen to be in or a small vehicle, all that plays a role on how much trauma gets transmitted through your body when you're struck or when you strike something else if you're in a vehicle. And these traumatic forces to the spinal column, I mean, you really want to try to consider a lot of different possibilities for these injuries, because sometimes you may think that you're fine and you don't really have too many symptoms, but you can still actually have a pretty sizable herniation, even if the trauma wasn't significant. Most of the time, there has to be a fair amount of force or trauma to cause these discs to herniate to the point where they're causing major symptoms. However, sometimes if we're looking at this column from the front, sometimes you'll over time cause some trauma, just small repeated traumas to your discs from, say, overuse, overwork, heavy lifting, that kind of thing. And what ends up happening is your disc starts to look like this. Like essentially, if we're thinking just an analogy, this would be your hamburger patty, these would be the buns, and the patty is like too big for the buns. In other words, that's called a bulging disc. That's a degenerative process that occurs in the spinal column along with these discs over time when you've done a lot of little tiny traumas to these discs and they start to lose their elasticity and their ability to resist compression. So that's kind of like a more slow developing chronic developing of a disc bulge or herniation. But most of the time it's going to be something more traumatic, like you used improper form, you bent down, you twisted, and you tried to lift something heavy. Something like that will typically cause these discs to just have too much force placed on them. And if there's already maybe a little bit of a weakening from progressive degenerative changes, then that's where the herniation could occur. At the end of the day, disc herniations are no fun thing. They're not a pleasant thing to experience. And most of the time when you have these types of herniations, something has to be done. So now we're going to talk about what the treatment options are. Now to start, depending on the size of the herniation. So if we're talking just a small one like that, say like that, not like this, but just a small herniation, like say that. Those herniations that are there, but not necessarily compressing the nerve roots themselves or causing impingement, they can be managed more conservatively with things like steroid injections, platelet-rich plasma injections, radiofrequency ablation, things like that to just calm this tissue down, calm the nerves down, so that you're not sensing the pain that herniation is causing. Now, when you get to the point where the herniation is this big, like that, and it's just obstructing or impinging nerve to the point where you're having loss of function, then there has to be a consideration for what's called a microdiscectomy, and that's where this portion of the disc herniation is removed. And oftentimes you have to have other commensurate surgeries like a decompression, maybe have to remove some bone to create more space for these nerves to not be compressed. But at the end of the day, those two types of treatments are usually kind of like a first line, right? First is going to be your conservative injections, PRP ablations. Then you talk microdiscectomies, where you take out the little portions. Then if the herniation is so bad, or you've just got like a circumferential damage to the disc, and you've got kind of like a protrusion around multiple areas, or whatever it happens to be, then in that case, this disc is just removed altogether. And that's basically called a disc arthroplasty, or a disc replacement. Now, disc replacements back in the day just weren't that popular because they had not found a good method or a good media to use as a disc itself, as a disc substitute is the word I'm looking for. But now, with today's technology, there's a lot of different artificial discs that work very well when you're having to replace a disc altogether. If you've got such badly advanced herniations, or if you've got degenerative changes that have just gone far too advanced to the point where you're getting bone-on-bone compression or contact, that type of thing, that's where getting these disc replacements is one of those possible treatments. And then, of course, the other treatment is just removing the disc and doing a fusion. And so they try to remove as much of the disc as possible and then force a compression and tie the two vertebral bodies together so that you end up with one fused bone. Now, the drawback to that fusion is you're going to end up with a loss of some of your range of motion. And then over time, the vertebral body, or I should say the disc of the vertebral body above and the disc of the vertebral body below, will then start to become more degenerative over time. So if you've ever been told you have a disc herniation, you want to consider all the possible treatment options. Start with the most conservative first, that being, just conservative care from physical therapy to maybe then getting an injection, maybe an ablation, and then if absolutely necessary, then you move on to a microdiscectomy. And then if that's not working, perhaps consider a disc arthroplasty or a disc replacement. But you want to make a disc fusion one of your last options, unless you have multiple levels that are affected. That's where replacement discs really aren't going to be an option if you have multiple levels, or if you've got really advanced facet disease. Now, as I mentioned earlier, the facet is basically where each posterior segment of vertebral body communicates with the next. There's a little joint. I'm going to put my finger right in it right there. That's called the facet joint. Sometimes you can develop really advanced facet degenerative changes and diseases, and that's also going to contribute to impingement of exiting nerve roots. In cases like that, especially if there's multiple levels, you have to just consider a large scale fusion to help manage that particular symptom. So hopefully this kind of sums up and answers a lot of different questions and possibilities of what a herniation is, what causes these herniations, how they're treated, and ultimately the debilitating state that these herniations can cause. So if you all have any interest in this or liked this video or content, please click the thumbs up button and subscribe if you haven't. It'll help the channel grow. But otherwise, I appreciate all your support. And on the next video, I'm going to be getting back into working on cars. I'm going to be working on the Bronco to start, and we'll go from there. So until next time, this is Motors and Medicine signing off. Thank you very much. Have a good day.